Could radiologists be the key to helping detect intimate partner violence? Well, that's what a new study suggests. But how comfortable are doctors with that added responsibility? We sat down with a radiologist from Baptist Hospital of Southeast Texas to ask that question. Dr. Raleigh Johnson III sees a lot in his field. He's easily laid his eyes on hundreds of thousands of images over the years as a radiologist and partner with Coastal Imaging Associates working out of Baptist Hospital of Southeast Texas.
We'll interpret MRIs, we'll interpret CT scans, we'll interpret plain films, and ultrasound imaging of the abdomen, the pelvis.
A new study suggests Dr. Johnson and other radiologists could come to the rescue and help detect intimate partner violence. He agrees.
We objectively look at the images, we see potential traumatic injury, and we're able to make those assessments.
IPV is defined as physical, sexual, or psychological harm caused by a current or former partner or spouse.
If they come in with a complaint of, well, I fell, and then they have injuries that are above and beyond what we'd normally see in a typical fall, we can start having this discussion with the clinicians, the radiologists can, about could this be domestic violence.
The study, published in the journal Radiology back in February, looked at the medical records from 185 patients referred to the Brigham and Women's Hospital Emergency Department. Almost all of the victims were women. 37% were African American, 28% were Hispanic. The average age of the victims, 34 years old. And on average, IPV victims underwent roughly 4 times more imaging exams.
Frequently, these patients are getting imaged at a rate that's 4 or 5 times more often than the average woman who comes to the emergency room. And they usually come in with violent type traumatic injuries with no history of violence.
Johnson says they see fractures that are out of proportion with the injury, and he sees a lot of head trauma.
Frequently, we'll see intracranial hemorrhage or bleeding in people who are describing a situation where, normally the concussive force wouldn't be as much to create that sort of a situation, especially in a young female.
In 2018, Baptist performed 162,814 imaging exams. So far in 2019, a little over 110,500.
I would say that it wouldn't be uncommon to see at least 100 different patients who come in complaining of spousal abuse. Those are just the people that are complaining per year.
When it comes to detecting IPV, Dr. Johnson does not mind having that added responsibility.
If you're passionate about helping people, which I think that everybody in our medical community is, it turns into sort of a fight.
Now, Dr. Johnson didn't talk much about male victims, and that's because he says it is rare that they see male victims. If you'd like to read more from the study, log on to our website, fox4beaumont.com, after the newscast.